Hi there, my name is Anna Vulgaris and I will be assisting you today. How are you doing? Okay, great. So I'm going to go ahead and give you some more information before you undergo the Mohs surgery. So the purpose of today's surgery is to remove the basal cell carcinoma that is located around here on your cheekbone. Now, I know you must be wondering what basal cell carcinoma is, so I'm just going to tell you so that way you have a better understanding. Basal cell carcinoma is a type of skin cancer that is within the third or deep line of cells within your epidermis, which is on the superficial or top layer of your skin. It's just this right here, which we can see. And it can typically look like a small bump, colorless in that region, or an ulcer. So the team that will be performing your surgery today is Dr. Grays, our dermatologist that specializes in Mohs surgery, and the pathologist, Dr. Dennis, who will perform a biopsy on your cancer in a microscope. The Mohs surgery is then done in stages. First, Dr. Grays will be removing a small section of cancer, and then next you will be bandaged up, and then you'll be placed in a waiting area, and then a technician will then prepare the slide for Dr. Dennis to review it through a microscope. He will be able to tell if Dr. Grays removed it all or if he needs to go back in and remove more. Once all the cancer is removed, Dr. Grays will close up the wound and you will be dressed again to prevent from infection. The procedure can range anywhere between 10 minutes to 3 hours depending on how much cancer needs to be removed. Now, the cancer on your cheekbone is more widespread, so it will at least take an hour, if not more. The longer you wait for the surgery, though, is not a bad thing at all, so do not get worried. It just means that the doctors are trying to remove all the cancer so you don't have to return for another surgery. Now that you have all that information, I need to go over scarring. Since the cancer is more broad, you will be at risk for more permanent scarring, but the surgeon is going to try his best to prevent as much scarring as possible. Scarring is not the most fun, no matter where it's at, but there are also numerous ways to help scarring reduce in size and color. So if you would like that information, I would be happy to give it to you after your surgery is over. Now that your surgery is over and you are cancer-free, I wanted to go over wound care with you. So first thing, do not remove the bandage for the first 24 hours, and then after the 24 hours are up, you are going to gently remove the bandage and then wash it with a mild soap and water, and then pat dry. Do not wipe it whenever the sutures are in. And then you're going to apply an ointment. If its area starts to scar and become dry, apply more ointment because it will heal faster and it will help with scarring. And keep movement to a minimum when the sutures are in. And if you see a little redness, it's okay, the wound is healing, but if it increases a lot, please call the office immediately. And now, lastly, we need to schedule an appointment 10 days from now to have your sutures removed. What day is best for you? Okay, great. Here is your appointment card. See you soon and heal well.